Hi everyone! You confirm know someone who snores in their sleep or even worse, sometimes stop breathing. Obstructive sleep apnea, or in short OSA, is a thing that everybody has been talking about. Today, we are going to focus on something that everybody has been curious about. If I have OSA, what are my treatment options? To answer to this, we have with us Dr. Phua Chu Chin, sleep surgeon from Sengkang General Hospital. Hello, Dr. Phua.
Hey Joey.
During my NS days, right, I have this friend or bunkmate actually who sleeps and snores really loud till all of us cannot sleep at night, and the next day we are like some zombies. In the end, right, he was like diagnosed with sleep apnea. So what is this sleep apnea?
Sleep apnea is this sleep disorder or condition where during sleep, the patient's airway actually blocks. And that's actually an area between your nose to your throat. This happens because when people go to sleep, people with obstructive sleep apnea, the muscles relax such that the tongue or the throat actually blocks up. And when this happens, oxygen level drops because air cannot go through the lungs. And in the long run, it can lead to a lot of health problems like high blood pressure, heart attack, stroke, diabetes, and more.
I see. So people like my bunkmate who have sleep apnea, what is his most successful treatment for OSA?
So one of the best treatment options that all of us as sleep doctors can actually offer is this machine or called CPAP. CPAP is basically continuous positive airway pressure therapy that draws in room air, pressurizes the air, and basically transmits it to the patient via this tubing and the mask. And when the pressurized air is actually going through the patient's airway, it actually opens up the airway and allows oxygen to pass through freely. This is actually one of the most effective treatment, or what we call gold standard treatment, which means whether you go to the United States or Europe, Singapore, most of us will offer this as a first-line treatment for patients with sleep apnea.
I see, but it looks really restrictive and like some hospital patient wearing one leh. So I'm really curious lah. Can I try it on to see how it feels?
Sure. Let me give you a hand.
Okay. Okay. Wow. It looks really scary, but after putting it on, I feel like I'm Bane from Batman, and then it actually feels alright lah. Yeah. So does CPAP really work?
So it's a good question. I have a lot of patients who are actually quite skeptical about this as well. CPAP looks scary, and a lot of patients, find it difficult to actually wear at night. But at the same time, I've actually, from most of my sleep apnea patients, who have used CPAP, I do have patients who come back to me telling that, wow, after using CPAP is one of the best sleep they've had in like 10 years. One of the classic one that I actually hear from my patients is that when they slept without CPAP, even when they sleep 10 hours, they still feel very tired. And when they use CPAP, even with just 5 hours of sleep, they wake up feeling very energetic. That's really one of the keywords they actually come telling me. They feel like when they sleep with CPAP, they feel more energized when they wake up. They feel like when they wake up, actually there's no brain fog, like the brain feeling very blurry, that kind of sensation. And my patients also tell me that CPAP can work in multiple aspects of their life. For instance, I have a lawyer patient who actually feel that when he uses CPAP, he's actually able to work through 8 to 10 hours of his work without napping in the afternoon. Likewise, I have a patient who is a father. He tells me this quite heartwarming story where he says now that he's used CPAP, he's able to sit through a 3-hour Marvel movie with his son without falling asleep. And that's important to him because he says at least when he's not falling asleep, after that he can discuss with his son what's going on, and that is meaningful for him. Yeah. So CPAP can be something that is actually potentially quite life-changing.
If CPAP works so well, right, then why are people looking for other alternatives?
So this is actually a very true scenario and something that I actually see day to day as well. So although CPAP is one of the most effective treatment options available, some patients just find it difficult to wear it every night to sleep. So for instance, some patients find that the CPAP tubing or the mask is a bit restrictive. So when they wear it, they can't actually turn to their sides. And some patients find that, when they sleep with the CPAP, they can't breathe very well. They feel like it's hard to breathe out or breathe in. And so in the end, for some patients, when they use CPAP, it actually affects their sleep quality more. So these patients are patients that we actually, help them explore other treatment options. But beyond this group of patients who've tried CPAP and really it can't work for them, we do actually have some groups of patients who with a bit of what I call psychological barrier. So, for instance, they find that actually just straight out in their mind, they reject the usage of CPAP straight out because they feel like, I really cannot take something like that. So for this group of patients, my sincere advice is that consider at least trying it out, because we do have patients who are quite afraid and fearful at the beginning. And once they use it, and they actually feel like, wow, they can actually sleep better, and their actually bed partner can actually sleep better as well.
So for this group of people, right, what are the steps they should take if they want to explore other alternatives for the CPAP therapy?
One of the sensible things to do is to actually consider making an appointment with one of your sleep doctors or ENT doctors or any hospital with a sleep unit. Because what we can do for you is that we can actually look at your sleep study results, we can do an assessment of your throat, your weight and so on, and to try and come up with a comprehensive plan to see what kind of other alternatives suits you better.
So if patient really feels that CPAP is really uncomfortable, what do you recommend?
So with this group of patients, one of the first things we can offer is something we call CPAP troubleshooting. So this is a session that our team at Sengkang Hospital offers, where our sleep technician or sleep technologist can actually go through with you what is it that's making CPAP uncomfortable. So for instance, sometimes they can do some mask adjustment, they can change the CPAP setting to actually make it more comfortable for you to actually use the CPAP. But however, there are some patients who try it and simply cannot tolerate. This is when we explore other treatment options with the patients. For instance, we can actually consider things like surgery, dental appliance, positional therapy, weight loss, as well as myofunctional therapy.
Wow, surgery, is it painful?
This is a question that I actually get a lot from my patients. So I must be honest and say that some of the surgeries, especially when it involves cuts inside the throat, can be a bit painful, like tonsil surgery or palate surgery. But of course, we don't leave you in pain. We give you painkillers, lozenges and gargles to help with it. But nowadays, with a lot of surgical advancements, there are also new technology or new surgery that are less invasive, that are less painful. So don't get too worried about it. Yeah.
So does surgery really work?
So I think this is a good question as well. When patients pay the money or they go through the side effects for surgery and things, they want to know whether it works. So sleep surgery can actually improve patient symptoms quite a bit. For instance, after surgery, the snoring or the sleepiness can improve. For example, I have a patient who actually lives in Jurong East, and he says he used to have to drive 20 minutes to work every day, and in this 20 minutes journey he always has to stop halfway to nap for a while before he can continue driving, just 20 minutes. But after sleep surgery, he finds that he can drive through without stopping, and he finds that the wife obviously finds that his snoring has improved quite significantly, that she can sleep well. But one of the downsides of surgery is that it's hard to guarantee cure, as in it's hard to guarantee that the sleep apnea index improves a lot. This is when we actually will recommend combination therapy. For instance, the same patient from Jurong East, after surgery, he worked really hard on weight loss. So after surgery, he, after the kids go to sleep, he will actually climb the HDB stairs with his wife. And true enough, after a few months, when he came back to see me, he lost weight. And after sleep surgery, his general snoring and sleep quality actually improved quite significantly. So surgery can actually work, especially if you actually choose the correct patients for surgery.
I see. So are there like different kinds of surgery, or there's only one? So what kind of surgery are there for sleep apnea?
So there's various surgeries available. Generally, you classify them into like the soft tissue surgery, the skeletal or bone surgery, as well as weight loss surgery. So soft tissue surgery are things where we take out soft tissue inside your throat, like taking out big tonsils, doing some trims to your palate or tightening it, or shrinking the tongue. Then there's bone surgery or skeletal surgery, where if you have a small jaw, we can actually bring your lower jaw and upper jaw forward to open up the space behind your throat to help you breathe better.
So is my jaw counted as small jaw or big jaw?
I've looked.
Okay, sure.
Okay, so I think your jaw is actually quite reasonable. It's not very small, but I have to say you do have a double chin.
Oh, so time for some weight loss.
So speaking of weight loss surgery is also a treatment options that patients can consider for treatment of the sleep apnea, especially if weight is the main problem. But beyond soft tissue, bone, as well as weight loss surgery, we do have the newer treatment options available, which is the hypoglossal nerve stimulation implant surgery that has just been brought into Singapore recently. This is an implant that usually we implant under the right side of the chest wall, and what it can do is at night when you go to sleep you can turn it on. This will send electric signals to the nerve that actually stimulates your tongue. So this signal basically makes your tongue and your palate come forward, and it can open up the space behind your throat to help you breathe better. So studies have shown that this can be quite effective in actually treating snoring and improving the sleep apnea index. And in particular, this is quite useful for patients who actually struggle with CPAP therapy. Yeah.
Nice. So there's so many different kinds of surgery, right? So does the patient choose the surgery they want to go for, or the doctor would advise?
In general, this can be more useful coming from a doctor's point of view, because the doctor can actually see how bad your sleep apnea is. They can actually do an assessment, which part of your nose or throat is blocked, or whether it's a jaw problem, to provide you with some advice as to what type of surgery is more suited for the patients.
I see. Then how do patients know when should they go for a sleep apnea surgery?
So this is a good question as well. Sleep apnea surgery is generally useful for people to consider if you actually try other options and really it can't work for you. So for instance, we have patients who tried CPAP therapy and they just can't tolerate it, or things like positional therapy and dental appliance and they can't tolerate it. Surgery can be a useful option for these patients to consider. Surgery is also useful in patients where you have something or in your structure or anatomy that we can correct using surgery. So for instance, as I mentioned before, you have big tonsils, we can take it out. That can generally make you feel better. You have small jaw, we can try and improve it. Again, that can try and help you feel better.
So Dr. Pa, you were talking about these dental appliances. So can you tell me how it works?
Okay, so dental appliance is basically this braces or retainer device that patients can wear during their sleep. What it does is, if you imagine this being the upper and lower teeth, is when you sleep, this basically brings your lower jaw or lower teeth forward. And because the lower jaw comes forward, the tongue that's attached to your lower jaw will also come forward, and the soft palate will come forward as well. So all in all, what happens is your airway behind the tongue and throat actually opens up and helps patients sleep and snore less. So this one, this dental appliance is usually more suited for patients who are not overweight and for patients with mild to moderate sleep apnea.
I see. So does this change my facial shape?
Okay, it's not that powerful that it will change your facial shape, but when you wear it for long, it can actually potentially change the direction of your teeth and can affect your biting and chewing function. So in general, we advise that if you are considering this dental appliance for treatment of your sleep apnea, is to see and do it with a professional orthodontist because they can help monitor your teeth condition.
Just now, you were also mentioning about this positional therapy. So how does it help?
So positional therapy is a type of therapy for sleep apnea that is useful for patients with positional sleep apnea. So this means, these sort of patients, when they lie on their left or right, their sides, generally their snoring and sleep apnea improves. So positional therapy is where you can use some device. It can be like a pillow, like a pregnancy pillow, or it can be like a backpack or a tennis ball kind of thing where you put on the back that prevents patient lying on their back where they actually, when they sleep on the side, the snoring and sleep apnea improves.
Talking about tennis, right? Are there like lifestyle changes that can help manage sleep apnea?
So this is one of the things that we actually advocate to our patients as well on top of our usual therapy like CPAP or surgery therapy. So lifestyle changes are important. So usually we encourage having active lifestyle where you exercise and you keep your weight under control. That can help prevent worsening of the sleep apnea. Secondly, other things that we advise is, to try and reduce your alcohol intake right before bed, because when you take alcohol, it relaxes the muscles and make your airway obstruct or block even more. Other than that, for patients, with snoring that improves when sleeping on their side, they can also consider sleeping on their side as part of their lifestyle management to try and improve their sleep and snoring.
I see. I also recently came across this myofunctional therapy YouTube video. So, can it help sleep apnea, or can you tell me more about it?
So, myofunctional therapy for sleep apnea is a set of tongue and throat exercises that improve snoring and sleep apnea. The concept is a bit like, like if I have a flabby arms, I usually go to the gym to do exercise to tone it up. So it's a similar concept for our tongue and throat. When you do exercises to tone up the tongue and throat, when you sleep, the tongue doesn't get so floppy and block the airway. Same with the throat, it strengthens the throat so that it doesn't collapse so much. So at Sengkang Hospital, what we've done is we've actually created a set of videos with exercises. We teach you how to do it. We also have a timer that you can actually follow and do it at the same time. So if you're actually interested, feel free to check out the link below.
Nice, be sure to check out. Lastly, you might think this question a bit weird, but can someone die from OSA if they ignore all symptoms?
So I have gotten this question sometimes as well. People ask, if I don't do treatment now, will I die tonight because I stop breathing in my sleep? So usually it's not so drama, okay? So because when we sleep, even if you stop breathing, your airway obstructs, our body have something called the sympathetic nervous system that protects us. It will try and wake you up a little bit so you can breathe again and your oxygen level comes back. But if this happens day in and day out, so every night when you're sleeping, if your oxygen keeps dropping and you keep having your airway blocked, in the long run, studies have shown that if you don't do any treatment, this can potentially lead to problems like heart attack, and people can die younger from heart problems as well.
So that's all the questions I have. Do you have any other advice for sleep apnea patients?
If you're diagnosed with sleep apnea, don't panic, don't get too scared. It's actually a very common condition nowadays. 1 in 3 Singaporeans actually have this condition, and worldwide, close to 1 billion people actually have this condition as well. And the good news is actually nowadays there's a lot of treatment options available. So if you have this condition, feel free to actually see a sleep doctor or ENT doctor about it. We can go through the different treatment options for you, and we can find something that's actually suited to your lifestyle and to your need as well.
Alright, thank you, Dr. Phua. Till next time, bye!
Yeah.